से ना कोई अब आप परेशान, क्योंकि जान से बचे जान।
When you step out into the middle of a world crisis, you are suddenly confronted with an awesome responsibility. And what amazes you is the phenomenal consequences of it all and the colossal human endeavor that will be required to address it. Diabetes, the seemingly innocent-sounding disease, has become the scourge of the modern world. A major problem in addressing diabetes in India is ignorance and inaction in coping with the disease. All too often, diabetes is only discovered when it is too late and serious complications have taken their toll. Jagran Pahel, part of the largest media house in India, and the World Diabetes Foundation of Denmark have joined hands to help raise awareness and promote prevention through a massive media campaign for prevention and care of diabetes in India. It is the biggest initiative of its kind in this part of the world. The sheer logistics, reach and impact of the campaign is staggering by all existing standards. The campaign that is reaching out to the common man is spread across 14 states of India. And within these states, it's reaching out to a whopping 96 districts. Over 660 awareness camps and 400 screening camps have been conducted and attended by more than 350,000 people already, spread over this huge geographical area in 190 days. During this exercise, more than 112,000 people have been screened, and almost 14% were identified as diabetic. This amazing reach and impact is the result of a meticulously planned and strategically aligned media campaign.
The mass awareness campaign organized by Jagran Pahel in association with WDF is one of such wonderful examples of building partnerships for social causes. The impact of this initiative is quite visible in qualitative and quantitative terms. I am glad that we could become part of this initiative.
The Jagran Plexus was involved at a larger level, where right from director to the regional editors, GMs and the brand team played a very important role in preparing this huge task. As a part of the preparatory phase, the various units and the respective teams were oriented towards project design, its objective, implementation, and the coordination roles of Jagran team across all strategic business units.
Why the World Diabetes Foundation decided to be partners with Jagran Pahel in this awareness program. The fact is that one of the biggest issues that you face in diabetes is lack of knowledge and information that people have about diabetes and the risk that they have of getting diabetes. And I think the media can play a big role in bringing about a solution to this problem, because the media can guide people, can provide the right information, and can give the right messages.
The entire campaign was based on the positioning platform Janj Se Bache Jaan, essentially meaning screening saves lives. The slogan feel and the rhyme in the words created a strong memorability and gave the campaign the much needed muscle to run this through 14 states, covering vast regions over thousands of kilometers. The idea was then built into a strong visual property and used across various mass media vehicles and delivered to the masses through a 360-degree coverage using the three-pronged media approach: print, radio, and the new generation mobile media. Print used advertisements and write-ups, which were then released in Dainik Jagran, India's largest read daily, with 56.6 million readers. Radio used the popular FM station Radio Mantra, which broadcast our campaign in all its 8 FM stations covering 4 states, reaching to 6 million listeners. A character called Dr. Mantra was created, who would advise and respond to queries on diabetes.
डॉक्टर मंत्रा पेशेंट को कैसे पता चलेगा कि उसकी डायबिटीज कंट्रोल में है या नहीं?
सबसे पहले तो डायबिटिक पेशेंट को जागरूक होना पड़ेगा, उसको अपने लक्षण पहचानने होंगे। अगर उसका ब्लड शुगर नॉर्मल होगा तो
And finally, the SMS mechanism 57272 was used to draw in feedback. More than 55,000 SMS messages have been logged already, and we are still counting. The total media reach is estimated to be a whopping 40 million.
We are committed towards social awareness for disease or any other activity which creates a better life for people. I have been tying up with various social organizations, including the World Diabetes Foundation, and we thank them for their continuous support. And to take this effort to the next level is very important, as this effort of screening the people will then go waste. So I can request the World Diabetes Organization to come forward, work with us, and we will help spread the message of controlling diabetes, as well as enable people to learn more about diabetes and extend our support to help and control diabetes.
To achieve these numbers and reach, we followed a well thought out plan, wherein the core components were the roadshows which preceded the screening camps, aimed at making people aware of the various aspects of diabetes by providing information and distribution of leaflets and conducting simple participative contests on diabetes to generate awareness. An 11-minute film on awareness is shown on a TV inside the fully branded van. The roadshow was followed by a screening camp, and those who are detected for diabetes are then referred to nearby health centers. Before the roadshows and screening camps, the local communities, key opinion leaders, doctors, and healthcare professionals are mobilized and involved in the whole process. India has the world's largest population of people with diabetes, and the number is increasing at a very fast pace. We are dedicated to creating the world's largest and deepest outreach program for the awareness and prevention of diabetes. As the caravan gathers speed and moves on to the next level in the coming months, we are confident as an initiative we would become unstoppable. Come, join us in this journey, where the journey is the destination.